We're going to be giving you a review on joints today. Joints hold bones together and give the skeleton the ability to move. It's also known as articulations. Every bone in the body forms at least one joint with another bone. Some functional joint classifications are synarthrosis, which the joint doesn't move, which is located in the skull where the sutures are. Another is amphiarthrosis, which is slight movement, which can be found in the vertebrae. And then we have diarthrosis, which is full free movement of the joint, which can be found in the shoulder.
There are many different types of joints. There are fibrous joints, which are held together by fibrous tissue, which have no movement. An example would be the sutures of the skull. Another one is cartilaginous, which the bone ends between the articulating bones is made up of cartilage, like in the invertebral joints of the spine. The last type of joint is the synovial joint. It's articulating bone ends which are separated by a joint cavity made up of synovial fluid, like all the joints of the limbs.
Types of synovial joints. The first type is a plane joint, which the articular surfaces are flat and can only use slipping or gliding movement. The movements are non-axial, so gliding does not revolve around any axis. An example is the intercostal joints of the wrist. The second is the hinge joint, which the cylindrical end of one bone fits into the trough-shaped surface of the articulating bone. This movement is uniaxial, which only revolves around one axis. It's angular movement in just one plane, and examples are the elbow.
Another synovial joint is the pivot joint, is where the round end of one bone fits into a long sleeve of another bone. It is uniaxial. An example of it is found where the tibia and the fibula meet. Another synovial joint is the condyloid joint. It is an egg-shaped articulate surface of one bone, fits into an oval concavity in another. It is biaxial, which means it can move in two directions. An example of it is on the knuckles.
Another joint we have is the saddle joint. It is where each articular surface has convex and concave areas. It is also biaxial. An example would be the thumb. Another joint we have is the ball and socket joint. This is a spherical head of the bone which fits into a round socket in another, like the hip.
Arthritis is an inflammatory and degenerative disease that damages the joints. The synovial membrane thickens and fluid production decreases to create friction. Symptoms can be pain, stiffness, and swelling of the joints. The first type of arthritis is osteoarthritis, which is a chronic degenerative condition that typically affects when you age. Cartilage softens, frays, and breaks down. Bone spurs grow around the eroded cartilage. It affects the fingers, cervical, and lumbar joints of the spine, knees, and the hips. Crunching noise is called crepitus with the movement.
Another type of arthritis is rheumatoid arthritis. This is a chronic inflammatory disorder. RA is an autoimmune disease in which the immune system attempts to destroy its own tissue. White blood cells from the blood enter the synovial joint cavity and release inflammatory chemicals that destroy the tissue. This makes a painus, which is abnormal tissue that clings to and erodes articular cartilage. Scar tissue forms where the cartilage erodes. Scar tissue ossifies and ankylosis occurs. This affects the fingers, the wrists, the toes, and the ankle. It varies by remission and flares up, and some of the symptoms are pain, and some of the therapy is drugs and physical therapy.
The last form of arthritis is called gouty arthritis. is a disease in which uric acid builds up in the blood and is deposited as needle-shaped crystals in the soft tissue of the joint. It painfully attacks the joint and mostly occurs in the big toe. If gone untreated, the bone ends can fuse together. It can be a genetic or environmentally influenced by diet. Treatments include colchicine and ibuprofen. Weight loss and avoiding alcohol will also help.